Obstructive Pulmonary Disease, Suffocation in slow motion. COPD, a chronic obstructive pulmonary disease, is an umbrella term for progressive lung condition that obstruct airflow and make breathing an agonizing task. Emphysema and chronic bronchitis are its primary manifestation. Together, they account for over 3 million deaths annually. The disease unfolds slowly, often over decades. Patients initially notice a lingering cough or breathlessness during exertion. As the lungs deteriorate, oxygen becomes a precious commodity. Many require oxygen tanks just to walk across a room. As with lung cancer, smoking is the chief culprit. Long-term exposure to lung irritants, smoke, air pollution, chemical fumes damages the airways and alveoli, reducing the lungs' ability to take in oxygen and expel carbon dioxide. There is no cure for COPD, but its progression can be slowed. Smoking cessation is paramount. Pulmonary rehabilitation, inhaled medication, and lifestyle adjustment can improve quality of life. In some cases, lung transplants offer hope, but the greatest victories will come from reducing exposure through cleaner air, safer workplaces, and aggressive anti smoking efforts. Lower respiratory infection, the ancient killers persist. Pneumonia, bronchitis, and other lower respiratory infections remain among the leading killers, especially of children and the elderly. They claim over 2.5 million lives each year, often striking hardest where healthcare is weakened. Pneumonia, the inflammation of the air sacs in one or both lungs, can be caused by bacteria, viruses, or fungi. It is particularly deadly when coexisting conditions like malnutrition, HIV/AIDS, or chronic illness weaken the body's defenses. In children under 5, respiratory infections remain a leading cause of death, particularly in sub Saharan Africa and South Asia. Here, prevention and treatment are often a matter of access. Vaccines, clean water, antibiotics can make the difference between life and death. Vaccination is a potent shield, immunizing against pathogens like streptococcus, pneumoniae, pneumoniae, Haemophilus influenza type B, and influenza has dramatically reduced infection rates where implemented. Good nutrition, hand washing, and reducing indoor air pollution, especially from wood or coal burning stoves, are equally vital. Neonatal condition, the fragile first days. The first 20 days of life are the most dangerous. Neonatal conditions, including preterm birth complication, birth trauma, and infections, account for over 2 million deaths each year. These are often invisible tragedies, quietly occurring in hospitals, clinics, and homes, especially in regions with limited maternal and newborn care. Premature birth is a major factor. Infants born too early often face underdeveloped lungs, brains, and immune systems. They are highly vulnerable to sepsis, respiratory distress, and hypothermia. lack of parental care, maternal malnutrition, infections during pregnancy and teenage pregnancies heighten the risk. But the path to prevention is clear: ensuring maternal health before and during pregnancy, providing skilled birth attendants, and improving neonatal intensive care can drastically reduce these deaths. Low cost intervention, kangaroo care, skin to skin contact, breastfeeding, antibiotics for infection, and sterile delivery environments are life saving by vitamins and supplements. A newborn fat should be A newborn's fate should not be determined by geography. Global efforts to strengthen maternal and child health are not just noble, they are necessary and attainable. Diabetes, the sugar trap. Diabetes is often framed as a condition of excess, too much sugar, too much food, too little exercise, but that framing misses the full story. With over 1.5 million deaths each year and millions more suffering complications like blindness, kidney failure, and amputations, diabetes has become a global health crisis. Type 2 diabetes, the most common form, occurs when the body becomes resistant to insulin, the hormone that regulates blood sugar, or when insulin production declines. The result is chronically high glucose level, which damage organs over time. Genetics play a role, but environment, lifestyle, and socioeconomic factors are decisive. Processed foods rich in refined carbs, sugary drinks, sedentary jobs, urban sprawl, and food deserts conspire to raise risk levels. Worse, many people with diabetes are unaware they have it until complications arise. Prevention requires reshaping both individual habits and societal system. Regular exercise, whole food diets, healthy weight maintenance, and avoiding excess sugar are key. Only a broader scale urban planning that encourages movement, food labeling, sugar taxing, and early screening program can shift the curve of this epidemic. Kidney disease, the invisible decline. Chronic kidney disease rarely makes headlines, yet it kills more than 1.3 million people each year. The kidneys, two bean shaped filters tucked beneath the rib cage, cleans the blood, regulate fluids, and maintain essential chemical balance. When they begin to fail, waste products will build up silently, triggering a cascade of damage. Diabetes and hypertension are the chief culprits, gradually eroding kidney functions over years. Other contributors include infectious autoimmune disease, certain medications, and inherited disorders. Often, CKD goes unnoticed until advanced stages when dialysis or transplantation become necessary. By vitamins and supplements, prevention lies in controlling food sugar and blood pressure, avoiding unnecessary medication, especially NSAIDs, staying hydrated, and undergoing regular checkup if at risk. If a simple urine test and blood carotene measurement can detect early signs. While kidney transplant and dialysis are life saving, they are also costly and inaccessible in many parts of the world. Strengthening primary care and early screening program efforts the best defense against this silent epidemic. Liver disease. The origin Liver disease, the organ that suffered in silence. The liver is our biochemical powerhouse, processing nutrient, detoxifying blood, and producing vital proteins. When it falters, the consequences ripple through the body. Liver disease, particularly cirrhosis and liver cancer, cause over 1.3 million deaths annually. The roots of the liver failure are diverse. Chronic hepatitis infection, especially hepatitis B and C, long term alcohol abuse, obesity driven fatty liver disease, and toxin exposure. Hepatitis B and C are particularly insid- in- insidious, often causing a no symptom until extensive damage is done. But science has changed the landscape. Effective vaccines against hepatitis B, antiviral treatments for hepatitis C, and public awareness about alcohol and liver health have transformed liver disease from inevitable to manageable. Preventing liver disease involves a mix of medical innovation and behavioral change. Safe injection practices, routine testing, avoiding excessive alcohol, weight control, and vaccination are powerful tools. The liver has a remarkable ability to regenerate, but only if we give it the chance. Tuberculosis, an ancient scourge reimagined. Tuberculosis has haunted humanity for millennia. Once called consumption for the bay, it slowly wasted away its victims. TB remains a global killer, especially in low income countries. It claims more than 1.2 million lives each year. Caused by Mycobacterium tuberculosis, TB primarily affects the lungs but can also target the brain, bones, and other organs. It spreads through the air when infected people cough, sneeze, or speak. Crowded living conditions, malnutrition, HIV infection, and weakened immunity amplifying its reach by vitamins and supplements. Though TB is treatable with antibiotics, multi-drug resistant TB, MDR-TB, has emerged as a formidable threat. In some regions, treatment can take over a year with severe side effects. Prevention hinge on early detection, vaccination, BCG, completing treatment regimes, and addressing social determinants. Addressing social determinants like housing and nutrition. Newer vaccine and shorter drug courses are under development, offering renewed hope. But TB will only truly be conquered when poverty, stigma, and neglect are also addressed. Looking forward, life, death, and the power of prevention. The leading cause of death do not emerge from nowhere. They are shaped by choices, environments, policies, and histories. While some are rooted in genetics or age, most reflect modifiable risk, smoking, diets, pollution, inequality, and healthcare access. Preventing death is not just about extending life, it's about enriching it. It is about children growing up free of preventable infections, adults living without the burden of chronic illness, and elders aging with dignity and strength. It's about communities empowered to make healthy choices and systems designed to support, not support is well-being. Each statistics is a story. Behind every number is a name, a family, a future that could be different. In knowing the cause of death, we hold the map to more life. And in prevention, we find the courage to change the ending. Thank you. Please subscribe, like, and comment.